Hi, Mike. My name is Dr. Pierce, and I want to ask you what brings you in here today.
I'm a I had an injury when I was playing basketball, and now I find myself addicted to Oxycontin.
So, from your injury, did you have surgery for that? Why did they is that why they gave you the Oxycontin?
Yes, I tore my ACL and I had to have surgery.
So yes, Oxy, that's a drug that physician usually prescribe as like a painkiller for people who have surgery. Um, how does it make you feel?
I feel weird because I keep taking the medication even though my knee doesn't hurt.
Okay. So how long have you been feeling weird from taking the medication?
I've been feeling weird probably ever since I started taking the medication. Since they prescribed it to me, but it used to help with my pain, and now it kind of just spiraled out of control, so I use it a lot.
How do you use it? Do you get the medication from somewhere?
I used to get prescriptions, but I have started stealing it from my grandparents.
Okay. Okay, so I'm very happy that you decided to come and see me today and are able to acknowledge that you feel funny and are brave enough to come in and talk to someone. So I'm going to conduct a DAST-10 assessment on you just to find out more information. The assessment is only 20 questions that you need to answer, and you'll just answer yes or no to those questions.
Okay.
So just so you know, you're not in trouble or anything from this assessment. Um, but I am a mandated reporter, so unless I learn that you're causing danger to yourself or other persons, or unless you inform me that you experience abuse, everything that you say will be kept private. Before we start the DAS-10, we're going to go over the confidentiality agreement, and I'm going to have you sign at the end and then ask me any questions.
Okay.
So in the agreement, let me go and get that agreement out. So it says, I, Mike, understand that I am being asked to complete the drug abuse screen test, which is a confidential assessment tool that is used to evaluate drug use, and related problems. I understand that my social worker and other professionals administering the DAS-10 have a responsibility to protect my privacy and to maintain the confidentiality of any information obtained through the assessment. So I hereby agree to the following conditions. So at the end, if you agree to all these conditions, then you'll sign. I understand that the purpose of the DAS-10 is to assess my drug use and the related problems, and that my responses will be kept confidential. You
Mm-hmm.
not in agreement. Thank you. I understand that any information obtained through the administration of the DAS-10 will only be used for the purpose of the assessment and treatment planning.
Yes.
I understand that my social worker and other professionals administering the DAS-10 will take all the necessary steps to protect my confidentiality and my responses, including scoring and completing assessment.
Yes.
I understand that my social worker and other professionals administering the DAS-10 will not disclose any information obtained through the assessment to any third party without my explicit written consent unless required by law or necessary to protect my safety and well-being.
Yes.
Okay, and I just need you to sign at the bottom and then we can start. So I'm going to let you know what the DAS-10 questionnaire is. So I'm going to read you a list of questions concerning information about your potential involvement with drugs, excluding alcohol and tobacco during the past 12 months. When you hear the word drug abuse, are used, they mean that the use of prescribed or over-the-counter medication slash drug in excess of the directions or any non-medical use of the drug. So drug abuse means using the drug for anything other than its purpose if it's over-the-counter or just excessive use. And some of those other drugs can include cannabis, solvents, tranquilizers, cocaine, stimulants, hallucinogens, narcotics, oxys, all those type of things. Okay, so we're gonna go ahead and start, and I just need you to answer yes or no for me. So for question number 1, it says, have you used drugs other than those required for medical reasons?
Yes, I guess after my knee was better, I kept taking the medication.
Okay, thank you. Do you abuse more than one drug at a time?
Yes, sometimes I smoke weed after taking some medication, but I wouldn't say abuse.
Okay, and remember we said abuse is just the when you overuse the drug, not as it's prescribed. Are you always able to stop using the drug when you want to?
No,
Have you had blackouts or flashbacks as a result of drug use?
no.
Do you feel bad or guilty about drug use?
Yes, especially when I take my grandma's, but I feel I can help it. I can't help it.
Does your spouse or parents ever complain about your involvement with drugs?
No, because they mostly don't know.
Okay. Have you neglected your family because of your use of drugs?
No,
Have you engaged in illegal activities in order to obtain drugs?
no, but I was thinking about finding someone to buy off.
Mm. Have you experienced withdrawal symptoms, felt sick when you stopped taking the drugs?
Yes, I guess is the extra funny feeling I have right now.
Okay, and that's why you came in today because you were feeling those withdrawal symptoms, and that's probably because you ran out of yours and your grandmother ran out of hers as well. Have you had medical problems as a result of your drug use?
No.
Okay, thank you, Mike, for being so open and honest and willing to answer the questions in this assessment. So we're going to score your assessment, and basically you get a point based off the yes or no questions. So every yes that you answer gets a point, and
Mhm.
the no's gets no point, but except for question number 3. So your score is a 5, which means you have moderate level of problems related to drug abuse. So the first step in aiding you with this problem was you coming in today and actually talking with someone. And I commend you a lot for that. That's like a big step. We're going to get you into some interventions and start up an intervention plan with you on our next in our next meeting and everything, just to help you aid you with your problem. So thank you so much again for coming in.
All right, thank you.